Hi, this is Dr. Lin again. Today we like to talk to you about the amazing effect of platelet rich plasma, PRP. So, the best medicine is what is the best medicine? The best medicine is natural, autologous, which is basically from patient to their own patient tissues, carrying no side effects, and accessible and readily available. So, PRP, platelet rich plasma, possesses all these qualities. So when God created man, He gave man all the essentials for healing that tissue, healing any wound, in these tiny packets called platelets. And platelets aggregate to form a blood clot when patients get a cut, for instance. And the blood clot is important, obviously, in healing. Not only that, the platelets release all these granules that basically recruits all the other cells, stem cells, and other immune cells to the site of injury to heal itself. And these are very, very important in the process of wound healing. So the degranulation of the platelets after it's been activated at the site of injury, there's many growth factors that's been like released from the platelets itself. These are called epidermal growth factors, insulin-like growth factors. There's fibroblast growth factors, the keratinocyte growth factors. Basically, keratinocytes is very important for the hair, for instance. Fibroblast is very important for collagen. So all these growth factors are present in the platelet itself. And the platelet also has the CD34 positive cells, which is important in recruiting stem cells to the site of injury. And stem cells can differentiate into all the other cells to make more of itself to heal that whatever tissue that we're talking about. So PRP has been used widespread in the field of medicine, especially in sports medicine and orthopedics. So these orthodox infuse that into fractures, into sprains, and ligamentous tears, and they're healing a lot of injuries, something like rotator cuffs, even their posterior and anterior cruciate ligaments, their ankle sprains. They're able to heal a lot of these very devastating injuries much faster with the use of PRP. So just bring up two stories. Kobe Bryant, when he had a high ankle sprain, he had PRP injected into that sprain, and he was able to play like 3 weeks later, which is quite unlikely if he did not have this amazing therapy. Heinz Ward had also a high ankle sprain, and right 2 weeks right before the Super Bowl. However, he had PRP injected into that sprain, and he's able to go on in the Super Bowl and win the MVP of the Super Bowl. So as you can see, the PRP has been widely used in ortho medicine, but our usage is mainly in a off-labeled usage in aesthetics, because this is not something that's FDA approved. However, this has been used for many years, for about a decade, into the face as well as the scalp for regeneration and healing. The duration of action is typically about 18 months. It should last about 18 months because it's your own tissue, and it kicks in your own collagen production. So it should be quite long lasting. However, the aging process marches on. So we still see these things. We can't stop that aging clock. So therefore, there is still that progression going on. The peak PRP effect should be about 1 to 4 weeks in the facial areas, and in the scalp areas for regeneration of the hair follicle, it's about 2 to 8 weeks. So platelets is basically concentrated extracted from the patient and concentrated with a centrifuge, and then to the point of about 8 to 9 times baseline. And this is now injected into the patient's face for facial rejuvenation, or into the scalp for hair follicle restoration. So many patients would want to actually have the male pattern hair loss, receding hairline, as well as the apex of the scalp start losing hair. These things it's autologous, it's from the patient's own blood, and it can be injected right in for that restoration. And the facial just the same thing as the dermal fillers that's been for facial volumization. PRP can be injected into the face for the rejuvenation of the face, as well as a little bit for volume. However, because over time collagen does fill up with volume, and the PRP does stimulate that production, the collagen production. Not only does it also in the face and scalp, the same rejuvenation can also be accomplished with even the sexual dysfunctions of men and women. So PRP can be used even into the penis for male rejuvenation, as well as female, the vaginal injections for the vaginal area after menopause. A lot of times the females start having a lot of dryness and lacking lubrication and redundant skin, etc. So the same can be also performed, the PRP, into the genital area as well. So at Anew Laser MD, we like to complement our PRP with hyperbaric oxygen therapies to increase that healing potential. So both does wonders for the healing. Oxygen in a pressurized environment increases circulation, increases more of tissue regeneration. The same thing does PRP. So we put it together for a synergistic effect, so patients are getting the best of both worlds. So the combination of these two therapies, I coined it as the hyperoxy PRP, and this is exclusively offered here at Anew Laser MD. Thank you.